But we have to pass the bill so that you can find out what is in it.
Great news. 31 million people are now covered by the Affordable Care Act. And I know someone who's going to really want to know that number is up as high as it is. But I got to call this fella.
Joe Biden, we did this together. We always talked about how if we could get the principle of universal coverage established, we could then build on it.
When we open up the enrollment period again and reduce the cost, 1.2 million people signed up on top of the 30 million.
The ACA, later known as Obamacare, which I take pride in.
And I keep reminding people.
It was built on a model that combined good ideas from Democrats and Republicans.
You were so good when Bo was dying. I literally remember sitting on the bed with him within a week or so of him passing away and thinking, what in God's name would I do if I got a notice from the insurance company saying you've outrun your coverage?
Well, the outrage and worry about the skyrocketing premium jumps for Obamacare participants has another troubling side effect. The cost to taxpayers is also going to go up. When President Obama signed the bill into law, he promised that costs would go down because healthy younger individuals signing up would offset the cost of coverage for unhealthy Americans with chronic illness and disease. Well, with enrollment set to begin November 1st, the Obama administration announced yesterday that premiums are set to jump an average of 25% across 39 states. In places like Arizona, premiums would jump by as much as 116%.
The effort was worth it. The families that have been able to care for their loved ones, be cured, have access to care, that all makes it worthwhile.
Well, back in March, the nonpartisan Congressional Budget Office estimated that taxpayer subsidies given in 2016 to cover Obamacare patients would amount to $43 billion for 2016. Well, that amount could jump to, get this, $106 billion by 2026. Tom Miller, he's a resident fellow at the American Enterprise Institute, said, quote, if you assume conservatively that there's 10 million people getting subsidies, that's an extra $8.5 billion in extra cost taxpayers are getting hit by going into next year.
I will not sign a plan that adds one dime to our deficits, either now or in the future. We've estimated that most of this plan can be paid for by finding savings within the existing healthcare system, a system that is currently full of waste and abuse. The only thing this plan would eliminate is the hundreds of billions of dollars in waste and fraud, as well as unwarranted subsidies in Medicare that go to insurance companies.
Doug Holtz, he's a former advisor to the president, told Fox News the math is simple. Premiums are going up and up, and subsidies are going to go up.
Today, after almost a century of trying, today, after over a year of debate, today, after all the votes have been tallied, health insurance reform becomes law in the United States of America.
Well, you will have to live under Obamacare, but Congress won't. Senators, representatives, and their top aides will be able to stay in their current health care system, so they will still get a taxpayer-funded contribution to help pay for their health plans. That's because of a last-minute deal worked out before Congress went on vacation for 5 weeks. The deal gets Congress out of the original language of Obamacare.
Every pen, so it's going to take a really long time. First, no matter what you've heard, if you like your doctor or healthcare plan, you can keep it. If you don't have insurance, you'll finally be able to afford insurance. And everyone will have the security and stability that's missing today.
CBS News confirms more than 2 million Americans have been told they cannot renew their current health insurance policies.
And that is more than triple the number of people said to be buying insurance under the Affordable Care Act, which the president himself calls Obamacare. Jan Crawford is in Washington. Jan, good morning.
Good morning, Nora. Good morning, Charlie. You know, there have been estimates of hundreds of thousands of people across the country losing their current coverage, but we reached out to insurance companies across the country to find out some real numbers. This is just the tip of the iceberg. And the people who are opening these letters are shocked to learn they can't keep their current policies despite the president's assurances to the contrary. It's an unexpected reality of Obamacare, being told through anecdotes in local papers and on social media. But the hard numbers reveal the evidence is far more than anecdotal.
If you are among the hundreds of millions of Americans who already have health insurance, nothing in this plan will require you or your employer to change the coverage of the doctor you have.
CBS News has confirmed with insurance companies across the country that more than 2 million people are getting notices they no longer can keep their existing plans.
If you have insurance that you like, then you will be able to keep that insurance. If you've got a doctor that you like, you will be able to keep your doctor.
Our democracy has always faced its share of challenges, but increasingly it feels like we're at an inflection point with rising inequality, deepening polarization, and widespread disinformation.
If you like your doctor, you can keep your doctor.
I plan to keep shining a light on the biggest challenges that democracy faces. That includes revitalizing our political institutions, coming up with more inclusive and sustainable models of capitalism, and creating a stronger democratic culture, but it also means creating an information environment that reinforces rather than erodes our democracy. One in which truth matters.
If you like your health care plan, you can keep your health care plan.
In California, 279,000. In Michigan, 140,000. Florida, 300,000. And in New Jersey, 800,000. And those numbers are certain to go even higher. Some companies tell us they've sent letters, but they won't tell us how many.
What we're seeing now is the reality coming into play.
Industry experts like Larry Levitt of the Kaiser Family Foundation say the insurance companies have no choice.
This bill is about peace of mind. Peace of mind for Americans to finally be able to lie there and know that God forbid something happens like it's happened to an awful lot of us, that I'm not going to lose my house. I'm not going to lose everything. I'm not going to leave my family in distress. When you cut to the chase, we're talking about eliminating close to $1 trillion in benefits that go to people to be able to meet the commitment we made that health care is a right, and we're transferring all of that to the wealthy. That's what this is all about. It's about a transfer tax, basically. Eliminating the Affordable Care Act means eliminating an awful lot of things that people badly need in return for what? So the 0.9% increase in taxes for people making over $250,000, couples can be returned to them, so that drug companies and insurance companies and medical device companies can benefit. It's a transfer of about $1 trillion.
Protect our care. Protect our care. Protect our care. Thank you.
I ain't going anywhere. This is not going to pass.
We are, of course, happy with the Supreme Court decision on the Affordable Care Act. I think it's really important to note this historic decision. Once again, the Supreme Court upheld the constitutionality of the Affordable Care Act and the transformational protections that it provides every American, no matter where they get their coverage.
The doctor networks, specific types of doctors were restricted, newly restricted in Obamacare private insurance. Fewer oncologists, fewer cardiologists, psychiatrists, even primary care.
We said from the start that it was going to be important for us to be consistent in saying to people, if you want to keep the health insurance you got, you can keep it. That you're not going to have anybody getting in between you and your doctor in your decision making. And I think that some of the provisions that got snuck in might have violated that pledge.
The choice of insurance plans, this is per county, dramatically reduced. Once the regulations were in place, there was a massive jump because insurers withdrew from this regulatory environment, and so you didn't even have a choice of what kind of insurance to
We will also create an independent commission of doctors and medical experts charged with identifying more waste in the years ahead. These steps will ensure that you, America's seniors, get the benefits you've been promised. And we can use some of the savings to fill the gap in coverage that forces too many seniors to pay thousands of dollars a year out of their own pockets for prescription drugs.
So now you have an interaction where the patient comes to see a doctor. The doctor is bound by federal law to follow protocols set forth in Washington, D.C. Deviation can be punished, and how they're going to punish is very hard to figure out. My reputation now is built on taking good care of patients. In the future, my reputation is going to be whether I stick to protocols. We know for a fact, first of all, that we've cut $500 billion from Medicare. So $500 billion, or half of the cost of the health care bill, is coming from deductions from the seniors. Patients like Ann will have to be spending a lot more of their own personal money to pay for medications that are not on the Medicare formulary. Some of my patients have that kind of money, some of my patients do not. So I'm all for reform that puts the patient in charge, gives patients access to all the doctors, and reduces costs. And we got the opposite in Obamacare.
On behalf of Association of American Physicians and Surgeons, Representative Brown was kind enough to join us, and he's got some ideas that we believe are taking the whole idea of medical practice in the right direction, Option Act in particular.
I believe there are several very sacred relationships, and I think that one of the most sacred confidential relationships is that of a patient with their doctor. Federal policy is destroying, and it has been destroying that relationship for a long period of time. And not only has federal policy been doing so, but also the insurance industry, through their policy, has been destroying that doctor-patient relationship. Because what we've done is we've injected a bureaucrat, whether it's a federal bureaucrat or an insurance company bureaucrat, between the doctor and the patient. And it has to stop. We need to build a system where the patient, along with their doctor, makes all healthcare decisions. And with Obamacare now, we have a law that not only is going to continue to destroy the doctor-patient relationship, but it's going to destroy the quality of healthcare. It's going to destroy budgets, whether it's family budgets, business budgets, states budgets, or the federal budget. And it's going to destroy our freedom. We already see an attack upon that as the Secretary of Health and Human Services, Kathleen Sebelius, made a tremendous attack upon religious freedom and conscience when she said that all healthcare plans are going to have to give free birth control pills, free pills that are designed to do nothing but create an abortion, and free sterilization, which flies in the face of the religious conscience and religious freedom of Catholics and many others across this nation.
I too want to join you in commending the President for his presentation this morning to us. It was one of confidence. It was one of values. That the Affordable Care Act was transformative in terms of what it meant in the lives of the American people.
For people who are out there who've been beneficiaries, there's some 20 million of them, what would you say to them as a doctor?
Did we really solve the problem? Copays are going up, deductibles are going up. They're giving you insurance, but have I really given you access to health care?
As Dr. Hill and many other doctors see it, the same exact care now costs more than it should.
I look at my office, and I've got a coder, I've got a biller, I've got somebody who works on prior authorization, pre-certification. All of those things have raised the cost of health care to the point where physicians went, I'm out.
Last year, Hill got out. His practice swallowed by one of Atlanta's largest hospitals, a growing trend across the country. That did reduce his costs, but now he worries about his patients. Why? Because big hospitals can charge more money.
For example, we decided to join Dr. Hill in the operating room
We understand that now that he's partners with the hospital, he can be doing the same type of operation on the same type of patient, literally in the same operating room, except the costs will now be 20 to 30% higher. The hospital that's partnering with Hill refused to comment for this story. So what is the solution? For Hill, it's about giving the market back to the consumer and letting doctors earn their trust.
Why do I need 535 people in Washington, D.C. to fix things? We're going to fix it. I have faith in that. Got it, and no catheter. I think the solutions are going to come from us.
And that health care in our country is a right, not a privilege. If there had been no other reason for us to pass the Affordable Care Act, one compelling reason was cost.
I would qualify for the lowest tier in Obamacare, which would have been about $80 a month. And I felt that that was too expensive. I'd rather just go into a walk-in clinic and pay $80 for the walk-in clinic fee for one time.
Since I have been an adult, I have never had health insurance. I spend roughly 1 to 3% of my income on health care, and that's for me and my wife and 3 other children.
When Obamacare first came out, I thought about it. It seemed like a good idea. Finally we're getting some health care in this country. I'd rather pay for the tax penalty than pay for something like $200 a month. It just breaks too much bank for me.
The premium was $725 a month for just me. The deductible was around $6,900 a year. And the coverage wasn't as good as what I have right now as a cash-paying customer.
The insurance that was offered through the exchange didn't have the alternative modalities that I'm interested, like chiropractic care, acupuncture, acupressure, things like that.
What frustrates me the most about the health exchange is that it's unattainable for an average person. It's just not affordable.
The cost to the individual, to families, to businesses, small and corporate, and to the public sector was totally unsustainable. So we had 3 goals. One was to lower cost, other to improve benefits, and third to increase access. In all 3 of those arenas, the Affordable Care Act has been a big success.
Obamacare was communism.
The way pools work, any pool, is essentially those of us who are healthy subsidize somebody who's sick at any given time. We do that because we anticipate, well, at some point we'll get sick, and we hope the healthy person is in our pool, and so those costs and those risks get spread. That's what insurance is all about. And what happens is if you don't have pools that are a cross-section of society, then people who are already sick or more likely to get sick, they'll all rush out and buy insurance. People who are healthy, they say, you know what, I won't bother. And you get what's called adverse selection. Essentially what happens is that the premiums start going higher and higher because the risks aren't spread broadly enough across the population. So you want to get a good cross-section in every pool.
The people that put Obamacare together either had one of 2 agendas. Either they were absolute economic morons, which there's a real possibility of that, or they fully intended to destroy the health insurance industry and completely put them out of business so that the government would be the only provider of health insurance.
How would you like to see it improved?
Well, of course, I wanted a single payer and I wanted a public option, but that not being in the mix, you have to prioritize what it is you want to get over the finish line.
Obamacare has cost my tiny little company millions, with an S, of dollars already in increased health care cost, health insurance cost.
If you strike out on your own and start a small business, you'll be able to get coverage. We'll do this by creating a new insurance exchange, a marketplace where individuals and small businesses will be able to shop for health insurance at competitive prices.
Now, when a little company like mine that has 600 team members is cost millions of dollars, there's a real simple effect to that. That's money I don't have to hire people with because it's going to stupidity.
Basically, you've got what we call 29ers, and a 29er is an employer who only hires workers for 29 hours a week or less to avoid these mandates under Obamacare, because you fall off a cliff if you're over 30 hours a week. And we see this, by the way, in the Bureau of Labor Statistics data that is showing us declining numbers of hours worked for workers. And that's a big problem, by the way, because how do you feed your family? How do you pay your bills, Melissa, if you're only working 25 or 28 hours a week?
But they were saying he was going to bend the cost curve down. A survey also found that 77% of companies have higher health care costs this year than last year. So there was no lowering of cost at all.
No, premium costs have been rising for a lot of employers. By the way, I got an interesting set of data myself on one of the effects of Obamacare, which is, people are doing tax preparations now, obviously, as April 15th approaches. And it turns out if you have an income over a certain amount, I forget the exact number, somewhere between $60,000 and $70,000 a year, you lose the subsidies under Obamacare. So I've had tax preparers tell me that they have people who are there, doing their taxes for, if they make $65,000 a year, they lose, say, $8,000 of subsidies. So they actually, Melissa, what that means is they have more than 100% effective tax rate on their income. That is to say, they'd have more after-tax income if they earned less money than more money. All of these are kind of perverse incentives that were built into the system.
Those scary stories about how your benefits will be cut, especially since some of the same folks who are spreading these tall tales have fought against Medicare in the past, and just this year supported a budget that would essentially have turned Medicare into a privatized voucher program. That will not happen on my watch. I will protect Medicare.
On Friday, the chief actuary for Medicare and Medicaid came out with a new report that showed that the situation for Medicare is actually a lot worse than was originally thought. Gone so far as to say for our seniors on Medicare, under the Obama health care law, it's going to be that much harder for them to get medical care and to see a doctor.
Heard about people being forced to get new insurance because of the Affordable Health Care law. Well, tonight, healthcare providers sound the alarm. Doctors from Atlanta, Arizona, and New York say the problems with affordable care go well beyond its website. The trio told members of a House Oversight Committee having an insurance card is one thing, having real access to care is yet another. 20 days away from the law's effective date, healthcare providers say there is no real way for them to refer patients to other doctors.
As an ophthalmologist, I will need a neurologist. But if that neurologist is not in that network, how am I going to give the patient with optic neuritis and sudden loss of their sight the ability to see a fine physician that I have sitting on my right? We have to fix this, and we have to fix this now.
The doctors were also critical of the so-called Bronze Plan, which comes with a $3,000 deductible. Even if you make a good living, they say it's a stretch to call that affordable care.
First of all, it is called the Affordable Care Act, and that word affordable is the word that we want the public to understand, the Affordable Care Act.
I sat down with House Speaker Nancy Pelosi. All agree she gets credit for locking up this vote, one of the biggest since Medicare in the 1960s. And she's said to have done it with an epic blend of persuasion, muscle, and will, even when half the town said it couldn't be done.
There's great anxiety in the country about the potential cost of this bill. And we went back and looked, and in 1967, the projected cost by 1990 of Medicare was $12 billion. What really happened is it was $107 billion, which is more than 8 times what they projected it would cost. What guarantee is there to the American people that this won't similarly balloon out of control?
Well, I'm so pleased that you're asking me about cost, because the cost of health care in America, both in delivery of service and insurance to families, is unsustainable. The upward spiral of rising medical cost can drive our country bankrupt unless we take this action now.
Obamacare is front and center today. That's because as the new enrollment season for coverage is about to begin, the administration announced its premiums will rise by 25% on average for a benchmark mid-level plan through the federally run market. At the same time, choices are decreasing. 1 in 5 consumers will have a single insurer to choose from. It's not a simple picture. Federal subsidies for most people getting coverage this way will increase.
Now, the other news that people have focused on lately has to do with notices that some Americans have gotten from their insurance companies, suggesting that because of the Affordable Care Act, they may be losing the plan that they bought. Now, while virtually every insurer is offering new, better plans and competing for these folks' business, I realize that can be scary for people if they just get some notice like that. Now, if you have or had one of these plans before the Affordable Care Act came into law, and you really liked that plan, what we said was you could keep it if it hasn't changed since the law was passed.
First, no matter what you've heard, if you like your doctor or healthcare plan, you can keep it.
So we wrote into the Affordable Care Act, you're grandfathered in on that plan. But if the insurance company changes it, then what we're saying is they've got to change it to a higher standard. They've got to make it better. They've got to improve the quality of the plan that they're selling. And that's part of the promise that we made too. That's why we went out of our way to make sure that the law allowed for grandfathering, but if we had allowed these old plans to be downgraded or sold to new enrollees once the law had already passed, then we would have broken an even more important promise, making sure that Americans gain access to health care that doesn't leave them one illness away from financial ruin. So the bottom line is that we are making the insurance market better for everybody.
Things are not looking good for people who are enrolled in Obamacare's exchanges because the premiums are going up by 70% in some states. The benefits are getting thinner and thinner so that sick people are having a harder time accessing the care that they need.
Michael Cannon, who studied the law for years, agrees with Bill Clinton's description of the current situation.
You've got this crazy system where all of a sudden 25 million more people have health care, and then the people are out there busting it sometimes 60 hours a week, wind up with their premiums doubled and their coverage cut in half. It's the craziest thing in the world.
Obamacare's insurance exchanges are losing major insurance companies, leaving many U.S. counties with only 1 or 2 health plan choices. Add to that an expected 25% increase in premiums next year. So what's creating this situation? It's a combination of insurance companies working to fulfill Obamacare's promises and not enough healthy people signing up. Now it's costing more than expected to care for those who are enrolled. And even when premiums are hiked by 50, 60, even 70%, it's still not enough.
What has happened in Obamacare is the federal government said, well, we're going to rob Peter in order to provide health care for Paul. The problem is they didn't rob Peter enough. And so the insurance companies aren't getting the sums of money they would need to fulfill all of Obamacare's promises.
Tevi Troy served as Deputy Secretary of Health under George W. Bush.
The private market is better at getting people covered. The employers are better at getting people covered. And we should be wary of policies that try and take people away from employer-sponsored care and move them into government forms of care.
Troy says what really worries him is where the nation is heading.
When all of the baby boomers will have retired, around when the Medicare hospital trust fund goes bankrupt, when the Medicaid annual costs go over $1 trillion a year, when, as some predicted, including some who worked on the ACA in the Obama White House, predicted that employers largely get out of the game. If all these factors come together, we're going to have a real healthcare financing crisis in this country.
But that is why Medicare we had to do the balloon out of control, and it did.
We're addressing some of the ballooning controls of Medicare and taking those down.
Blue Cross Blue Shield in the state of Tennessee is the largest insurer. They just pulled out of the exchange. What's that going to do to the economy? 1/7 of the U.S. economy is healthcare, and it just went up 62 and 44%. And this state is indicative of what's happening in every other state. It's not like Tennessee's pregnant and got a different issue than everybody else. This crap is coming down from Washington, D.C.
Evidence of governance would be how we rolled out the Affordable Care Act. It is intact. It's beautiful. As with everything, it's a work in progress. We need to improve it. but the website didn't work, and now it's well. For like $425 million were spent on ads against the Affordable Care Act. $27 million were spent on ads supporting the Affordable Care Act. That's just ridiculous. You know, it's more than, it's really incredible.
1/7 of our economy just doubled in expense to your back pocket.
We just couldn't be prouder. I believe that it's a winner. And by the way, it's called the Affordable Care Act. It's called the Affordable Care Act. I know you didn't intend any compliment or derogatory, but it's called the Affordable Care Act. Affordable. Good. Affordable. There's a reason. Affordable. 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 Affordable.
You know, you suck money out of the economy with a vacuum cleaner called socialism on some kind of trash like this. Now, that's not just an opinion. It's an actual fact. It's occurred with my company. It's occurred with thousands, tens of thousands of companies just like mine all over America.
Affordable. Affordable. Affordable.
The White House claims Obamacare helps small businesses and makes healthcare more affordable, but actual small business owners say something very different. Steve, I'm going to put up a slide here. It shows how will the Affordable Care Act affect your small business franchise, a survey of small businesses. 64% said it had a negative effect. Steve, why?
That's amazing, isn't it? And by the way, all the Obama administration needed was more bad news about Obamacare. But you're right. This was one of the central promises that was made, Mary, back in 2008 and 2009, was that we would have Obamacare and small businesses would love it. It would make insurance more affordable and easier to find. And now we're finding exactly the opposite, that when you actually ask people who own small businesses, the employers in this country, by about a 10-to-1 ratio, they say that it's a negative for their business rather than a positive for their business. This is a big problem. Let me just add one other thing, Mary. The poll also showed that you've already got nearly a quarter of all businesses, between about 40 and 200 workers, that are saying they are moving to part-time workforce because of the new mandates under Obamacare.
Why is it that this bill has been so unpopular? Did the Democrats blow it in messaging?
The Republicans spent, you have to remember, that the health insurance industry and their allies spent over $200 million mischaracterizing the legislation. We were busy writing a bill, gaining compromise and the rest. They were putting, we could stop what we're doing and try to go raise $200 million. We don't have their special interest resources.
Darrell Issa, maybe you were familiar with that name. He's a Republican from California, and he's been on the warpath with regard to several issues regarding President Obama. Now he has released this new sort of report, I guess we should call it, on the fact that he says that the Obama administration has used propaganda to boost some of his priorities, like healthcare. Ding, ding, ding.
That's
something
right.
you know a lot about.
Yeah, he said that there are 11 separate incidents where the Obama administration is illegally using propaganda to boost its priorities. And on the healthcare front, he talked about a couple of them. One is $700,000 Andy Griffith commercial touting the alleged benefits of the new healthcare law. And then secondly, talked about this kind of covert blog operation where a Justice Department spokesperson and perhaps others went online and anonymously said positive things about the president's plans with regard to health care.
Sure.
And called him to task on that, and about 9 other things.
And now we learn that the Department of Health and Human Services has signed a $20 million contract with a private public relations firm to continue to promote this flawed health care law. So today I'm calling on the president to cancel this contract. The American public want real solutions to problems of health care, not more press releases and propaganda paid for with their taxpayer dollars.
But that was a characterization that is hard to undo. But now that the Supreme Court has acted, you see the momentum is with us. The is a big change in terms of public perception of the legislation. I think that will only get better as people enjoy their benefits.
Historic Gettysburg, Pennsylvania, where Deborah Starry manages a Civil War-themed art gallery. She's covered under Obamacare, but having voted for Trump, she wants to see it replaced.
What's not working about Obamacare for you?
The red tape. It should be as simple as me paying the premium, me going to a doctor that I want to go to.
She admits she didn't have insurance before Obamacare and her premiums have stayed under $300 a month, but her deductible has gone from $1,700 to $4,500.
And that's a lot of money.
For me, it is.
Meanwhile, 600 miles away in Crestwood, Kentucky, the Abel Pearsall family voted for Clinton. Obamacare covered the cost of having a baby. Losing that coverage, they say, would be a big blow to their hopes for the family farm.
Like most small business owners, we're kind of bootstrapping this. We've been at it a few years.
Nationwide, the Affordable Care Act, or Obamacare, has brought the percentage of Americans without health insurance down from 16% to nearly 11%. Premiums have jumped dramatically in some states, but nationally they're up 20%, slower than the rate before Obamacare took effect.
If health insurers feel that everything is uncertain, will they drop out of the ACA marketplaces?
Deborah Starry admits she's conflicted. She wants Obamacare repealed, but she needs the coverage.
And I have no issue with paying my fair share, but it's got to be a fair share that I can afford.
Looking at growth in healthcare costs. So this is not premium growth. This is the underlying costs. And what's happening is you're seeing a chain reaction. There has been, since the Affordable Care Act passed, $50 billion in mergers in primary care providers, so hospitals. And what we're seeing right now is insurers are trying to keep up that growth. There was a brief dip because of the recession. You see that spike there in 2014, right after the marketplaces kicked in. The long-term trend, however, is going to continue to climb. People are getting older, more people are acquiring insurance. There's a lot more money in that pool.
And it's way above inflation. I mean, the real growth within the sector is breathtaking. What does that say about the Affordable Care Act?
Well, it seems like there are two problems to fix in health care. One of them is making sure that people are covered. The other one is dealing with runaway costs. So we have addressed one. There is a lot more to do to address the second, which is runaway costs. There were some experiments in the Affordable Care Act. Some of them have borne fruit, changing the way people provide coverage. But we really haven't addressed this huge problem. As I think everybody at the table knows, our healthcare spending per capita is beyond all proportion of any other country.
Access to doctors and hospitals in private insurance was reduced under the Obamacare law. Plans went from sort of broad coverage to narrow. This is narrow in terms of the networks that accepted patients with that insurance. Here's one sort of stunning example. You think, oh, wow, we have the best cancer hospitals in the world here. I have cancer, I'm going to go to MD Anderson, Sloan Kettering, Stanford. Well, no, those places, you may have insurance, but they don't accept that insurance under the Obamacare exchanges.
I am very proud of the work that my husband has done to fight to make sure that everyone in this country has access to health care. So yes, I do think that's an important legacy.
The choice of insurance plans, this is per county, dramatically reduced once the regulations were in place.
But we have to pass the bill so that you can find out what is in it away from the fog of the controversy.
The Democrats have gone crazy.